Have you ever heard about EMDR therapy and wonder what it is? Today, I'm going to talk you through EMDR therapy and how it might be helpful for you in your mental health treatment. So stick with me and we'll walk through it.
Any stories shared in this podcast have had names and details changed for the confidentiality of clients. Any resemblance to someone real is coincidental.
EMDR is eye movement desensitization and reprocessing therapy. In this kind of therapy, we are addressing usually trauma. That was what the therapy was originally created for, but it's actually been helpful in treating other kinds of disorders like depressive disorders and anxiety, self-esteem problems, and lots of other things too. For EMDR, there are 8 different phases, and each of these phases is a different part of treatment. But if you're in EMDR therapy, you probably won't know what phase you're in unless your therapist actually tells you. In the beginning, there's going to be a history-taking phase and a preparation phase. These are going to feel just like other kinds of talk therapy. You'll be talking to your therapist about what kinds of things have happened in your history, the ways that you think, and the ways that you respond to different situations in your life. In the next phase, preparation, you're going to be learning different coping skills and different ways of managing both your thoughts and behaviors. This is a really important phase of therapy, though sometimes people feel a little confused about it because they're not actually processing trauma. But if you skip this phase of therapy, you run the risk of getting into trauma processing without being ready for it. To be able to process trauma, you have to be able to recognize your own emotions, tolerate them to a certain extent, and manage some of your behaviors. Preparation phase can take anywhere from 1 session to kind of a long time, depending on how prepared you are and how many internal resources you already have so that you're ready to process trauma. After you finish these first 2 phases, you'll actually go into the next phase of therapy, and these next phases will probably all be done within a single session. You will select a target. You probably will have selected it before you start this in session, but you'll select a target to work through in therapy. That target will either be a memory that's problematic for you or an internal belief or feeling that you have that ends up causing you significant problems in your life. You'll sit with your therapist and notice the specific target, and then they're going to ask you some specific questions about that thing. So let's pretend for just a minute like we were processing through a car accident that you were in. And as a result of the car accident, you notice that your body has all of these triggers that come up around driving in the car and around driving past certain spaces. You might notice that there are certain thoughts that are associated with it, like, I don't have any control, what if this happens again? And you might notice different parts of memories that come up, maybe like the picture in your mind of the actual car accident or the sensation of your body, what it was like when the impact happened or the shock afterward. So the therapist will ask you about the very worst part of that. What is the worst part of the memory? And then they will ask you what belief you hold because of that. Most of the time, those beliefs sound something like, I feel like I'm not a good person, or I don't have any control, or I'm bad, or I'm lovable, something along those lines. Then the therapist will ask you to identify something that you would rather believe. These are thoughts that could be more of what we call positive cognitions, things that you would like to believe by the time that you're done with the processing. After that, the therapist will ask you some about how much you believe those thoughts and what you feel, where you feel it in your body, and then they'll start the actual processing. EMDR is a little different than other kinds of therapy. People often use eye movements to process. This means that during the therapy, the therapist will ask you to notice something, and then they'll ask you to follow their fingers with your eyes, and your eyes will go back and forth like this. It can also be done without eye movements, doing something like tapping, or sometimes there are these little things that you can hold in your hands that are called tappers that just do a little slight buzz from one hand to the other. I once joked with one of my clients that it was going to give them a little shock. I thought I was being funny. It wasn't funny, and it doesn't actually shock you. It kind of feels like when you're waiting at a restaurant and they have one of those buzzer things that you hold so that they can call you and let you know when your table is ready. So the reason for this is because whenever you're holding tappers or moving your eyes, we're doing something called bilateral stimulation. This means that we're passing information along the midline of your brain from side to side. The purpose of that is to help your brain make better sense between thoughts and emotions and sensations. We're trying to help your brain figure out how to process through the event and the associated sensations to make better sense of them. Sometimes I tell people it's like we're trying to help your brain file this away differently. That way we don't have to have the associated maladaptive beliefs, and we can feel differently about the specific situation by the time that we're done with processing. Over time, in this process, your body will become desensitized to whatever it is that you were processing. If we go back to the example of the car accident, if you're processing the car accident, your body will often become less and less responsive to that trigger or that image in your mind as you go through the processing. Once the desensitization phase is done, that means that you won't feel the distress that you felt when you started processing this memory. After that, you'll do something called an installation phase. This is the part of therapy where we help your brain to install that positive thought that you wanted to believe. So instead of, I have no control, we might go to a space of, I have control over lots of things in my life, or I can have control over how I feel about this now. And that would be something that we could install so both your brain and your body believe that statement. After that, you're going to be doing a body scan to make sure your body agrees with the work that you just did. This is actually one of my favorite things about EMDR as opposed to other therapies like CBT or ACT. Sometimes in other kinds of therapies, you may know what it is that you should be thinking or that would be a healthy and helpful thought, but it won't feel true. And so it kind of feels like you're trying to talk yourself into believing something you don't believe. In EMDR, we're trying to get your brain and your body to match up. And there are lots of things that your therapist can do in session to help you get to that point. Once you have been through this whole process, then you will go through some closure with your therapist where they'll help you take some breaths, step back away from the memory or step back away from those feelings and put those away so that you can revisit them at another time if the memory is not completed. Or if the memory is completed, you won't really have anything that you need to put away. So these are the different phases of EMDR treatment, and hopefully this gives you a little bit of an idea about what you're in for if you were to go into an EMDR session. I think it's really helpful to know that you can work through traumatic memories even if you don't have an exact clear timeline or story behind the memory. You can work through feelings that you have about yourself and about others. You can work through attachment wounds, problems that have happened in relationships, and just ways that you feel about the world in general. These can be things that you can work through in therapy, and I've seen people have great results from using EMDR. So find an EMDR therapist today.
If you enjoyed today's video, please like and subscribe. Thank you so much for watching. We've got other videos for you to check out and more exciting things coming soon, so thank you.